I want to raise my voice here. So thank you all for coming to our first ever Young Alumni Speaker Series event. Please clap it up for yourselves. Nope. Clap it up for yourself. Louder, a little bit louder. There we go. It is my honor to not only introduce Dr. Nadine over here, but it is really a full circle moment for me because Nadine was actually one of the students who was at my interview for my job. So now I'm inviting her back to Pullman, and that's a beautiful thing. So please make some noise for the amazing Dr. Nadine.
Oh my gosh, big girl voice. Can everyone hear me? Let me move it. All good? All good? Okay. All right. It is honestly really, really interesting to be back here. Only because when I graduated, this is why you shouldn't say the N-word never, I said I would never, ever come back here. And look where I am right now, today. Clearly, I'm back here. But, so, Reese reached out to me and was like, hey, students, there's like something that we're kind of creating. I feel like for the students that would be really beneficial to them, and I didn't realize I was the first that was gonna do this, but I feel honored to have that role. So basically, I was trying to think of what would really be beneficial to talk to vet students in particular. Like if I was in your shoes, your shoes literally just a year and 3 months or so ago, technically I just graduated, I'll get into a little bit, but what would I wish I would have known in your shoes that would have prepped me for the real world is what I would say. So this is kind of what I've come up with. Mostly stories, because I love stories. I feel like it sticks a little bit more, so a little bit less like research, science-based, but more anecdotal. But I really, really think stories help hit a little bit more home, and you'll see a little bit why as I kind of go through things. Okay. All right. So the topics in general, very general topics. I'm gonna intro myself, talk a little bit more about money, and then the tears part of my presentation was more about euthanasia and being human. And the last part is like what really matters. And this is more of my personal belief. You all don't have to share this, but this is what I found to be true for myself and what I saw. Oh, and then, I don't know, I was looking at pictures. I don't know who keeps telling these people to put their stethoscope right on the chest for their animals. And it's so like common, and so like here's another one. Like, what are you guys finding? Like, what are you learning from this? There's another one. Anyway, I thought it was really funny because I'm like looking at these pictures, and clearly whoever was taking them was not in the medical field. All right. Okay, so about me. So before I was a veterinarian, I was actually very competitive in judo. I was on the US team, and then I decided, it's funny enough, I burned out, and then I decided to turn to a career that was also high in burnout, but mostly because I really, loved animals and couldn't really see anything else that I would love doing every single day of my life. I worked a little bit before I went into vet school. I actually got waitlisted the first time, got in my second time. And then, so after I graduated 2024, May of 2024. I know you all know the person that's giving me my hood over here. He made me, by the way, kneel a little bit. This man, could not believe, but anyway. And then after I graduated, I went into a small animal rotating internship for a year, got done in mid-July. And after that, I've essentially been a relief vet in GP and ER. And then, so what I've been doing essentially, I like to say surviving with matcha. And I call it the big booty bill. instead of the big beautiful bill, because we all know how much of a pain it's gonna be for not just me, because I'm feeling it, because everybody in mine have to go through it, but everybody after us is gonna feel it. And then imposter syndrome, because imposter syndrome very, very real, especially someone that came from a athletic background. And then a lot of stuff happened while in vet school for me, and so anyway, so I had to work through all of that, and especially when I went to an internship where you were working with people that had like 20 years experience, that knew everything, and they were like, you didn't know that? I was like, no, I didn't know that. It's not something vet school teach me. But anyway, I was hoping that today is that you learn something from what I have to bring, and then hopefully laugh a little bit along the way too. Okay, so first topic is money. Money in general. And I know a lot of people are like, oh, money is the root of all evil, blah, 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 all of that. But fortunately, money does kind of run the world. We need it to pay our bills. We need it for our clients to pay us. We need it to pay the hospital. We need it to pay school. So all of that. So what I'm gonna go into next, essentially, is more about the clients first. Because I feel like while we have our communications curriculum, we are not necessarily talked to about how we talk to about our clients about money, which is one of the biggest thing I feel like. So I am gonna go into a little bit more. Basically, so yeah, titled it, Vet School Taught Me Anatomy, but not how to ask for $3,000 politely, which is a very, very common thing you're gonna do, especially once you're out in GP or whatever else you do. So things that I wish I learned was how to be able to talk with numbers without sweating and being nervous and stuttering and feeling like you're just trying to take money from them. Being able to speak basically medical terminology and turn it into something I would say lay people would understand, non-medical people. And then things that I wish like I could fall back to is like, how do I explain these things to them in general? And I'm gonna kind of lead more into a story. This, I will call him Fluffy. He's a 2-year-old male neutered bulldog, presented to me as about like a month or so ago for a history of severe skin issues that hadn't gone better with treatment. And then dad is what seems to be a retiree. And so this has been an ongoing issue, like has been happening for months, keeps coming back for it, it's not getting better. Now I'm coming in as the relief doctor and be like, this is a problem. We can't keep doing this, because obviously animal is itching, hurting, all of that, suffering in a sense. So how do I start talking to this client? Because initially he really was not open, I would say. Well, he was open, but he was very resistant to doing a lot of things. But the one thing I really would like to emphasize on, especially when you're talking with your clients in the future, is connecting with them. And what is the common ground, if you will, that we share between us and the clients? Someone, let me know. Common ground. Love of animals. What's that?
Want what's best for the pet.
You want what's best for the pet. What else? That is typically about what the main point is. And I think coming back to it, you really should bring the animals, so in this case Fluffy, really as your main center. Because I kept talking to him and be like, hey, like I understand this has been going on, you just want to treat the itching, but I'm really worried here that there actually is something more going on than just skin issues. And he was him and hawing, and also the other thing is, Fluffy here is not a happy Fluffy. He gets very mad if you go anywhere near him. gets very bitey, growling, all of that. And so that's another component that people don't really talk about. So, how did I get this guy to kind of get into it? So again, like I said, I brought the main front of like bringing Fluffy in to the center and be like, hey, I'm really worried for him. I don't think it's going to resolve we're just gonna put a Band-Aid, if you will, on what we're doing if we keep continuing this direction. And he did eventually draw blood. We got him to draw some blood. And then, so if you think, so this is a little bit, I don't know what everybody's levels are, but it'll help you. I have a dog that has skin issues, pot belly, on blood work, elevated ALP, elevated platelets, what is one thing that should be coming up to mind? A disease. Great. What's someone yell? Cushing's. Great. Perfect. Yes. Cushing's disease. All right. So that's just one thing that we need to like start really thinking about. And that was on my mind, and like everything was fitting into picture, but unfortunately he still was like, I didn't get him to do his testing, unfortunately, because I think in his mind, the whole Cushing's testing, obviously a whole day thing, and he didn't want to do that. And I was like, ultimately, you know, we're here to support you. If anything happens, come back and we'll work with you, okay? And then I did insert one thing in here. I also have to figure out where the time is to make sure I'm not going over time. Is there a time somewhere? Okay, great, thank you. So I did one research about like communication, because I'm a huge component of communicating. And this one was about surgeons, human surgeons in general, and like the communication and basically money in general, right? And so they essentially find that in this specific study, they had 56 surgeons, and then they basically put them through a communication, kind of training. And then they found that by improving essentially their communication, they were able to increase their payments by 25%, number of patients by 26, and charges by 21. So it really, really is, it's like how, it's not always what you tell, it's how you say it. It is sometimes what you say, but communication is such a big thing that we really need to have a little bit more focus and understanding of it when we talk to our clients. Okay, how many people here have dealt with financial clients? Okay. Has everybody else not? Because I see like some hands up here, so I don't know where everybody's at. My hands, can someone raise your hands real quick? Who is that with financial clients? Okay, just curious. For those that haven't, know that you will. It's not a matter of if, it's a matter of when. So basically, another story that I had, wonderful story, still sticks to my heart to this day. I worked at an emergency. I picked up a shift in an emergency hospital. And emergency, as an emergency does, everything was coming in at once at the same time. One of them being a hit by car dog, 2-year-old female spayed Cocker Spaniel. And the reason I'm putting this up is because the owner brings in, and of course, doesn't even have $100 to pay for the exam. And so, we talk about this in vet school, but we don't really talk about like, how do we deal with this situation? And now I'm in this situation, I'm like, oh, what am I supposed to do? What am I supposed to do? Because obviously I want to help the animal, I want to help the person. Well, how can I help them when they don't even have the money? And then, of course, our lovely clients, in their anger, are like, literally, she said to me, "You're just gonna let her die?" And I'm like, no, hold on, ma'am, I'm trying to help you. And I had like already started, so I'm a relief vet, and so I don't know how the hospital works, I don't know how like the staff works, and I was like, okay, you know what, screw it, sometimes you just gotta stick and do the best you can. So I started her on fluids, I get her some pain meds, and in the meantime, while she was trying to sort out her life and all payments and all of that, I was just basically making sure this animal blood pressure to keep it up and stop it from dropping as best I can with what I had, which was like fluids, which wasn't a lot, but it's what I had without, putting in a hospital in a hole. And so I know we have like our ethics class, but like I wish I was told a little bit more about like, what are the laws that I should be aware about? What are the things and the essential boundaries and the things that I believe in that I should be settled in before I go into practice? Because when you're in that sort of situation that I'm in, like luckily for me, I've been in the ER actually for quite some time, so it's expected. But if you have never been in such an environment, it's incredibly stressful. It's gonna put a lot on you, an emotional burden. It's gonna fatigue you, compassion fatigue you very, very quickly. And so ultimately, you can only provide the best care with what you have. And just know that. And you are gonna have to unfortunately accept that, because I know we would want to fix everything, save everyone, but there are just some situations that we're gonna have to, what's gonna happen. And then the other thing that I brought up, because there are other things like possibilities, is like the medical director, resource out your staff. There are other payment plans now that people may or may not be aware about, so scratch pay, charity, care credit, Good Samaritan Fund, technically some hospitals have. Try to surrender the animal if they can. Technically, humane euthanasia ultimately is not an ideal, but it is an option, because if nobody can pay for it, if she can't care for it, the animal is suffering, that's an alternative. This is the last one, is not an ideal, but is technically an option. If it does happen, make sure, I would say, to make them sign a waiver against medical advice. So out of all of those, which do you think she chose? Louder? AMA. She brought that dog home. No matter how much I warned her. And it's also not because she 100% wanted to, it's because she did not have the finances to keep her in hospital. All right. So this part is essentially talking about the better your skills are, so essentially the more that you have them, the better you're upkeeping them, the more essentially you're able to earn, is what I say. So next is, I'm just gonna show you this, I try to be as clear and open as much as possible. And the next is actually my own bank account and what I earned after working for like a month or so in a hospital, okay? Because this is why I just want to open your eyes and let you aware that there's not just one way, there's multiple ways. So this is how much I earned in 1 month, okay? And I'm saying this because initially, I would never have gone this far if I just overall looked at the hospital, because the hospital I worked at didn't have a lot of reviews. I didn't know anyone there. The hospital is kind of old, had a lot of older staff, and then, so I didn't know anything about this hospital, and I basically took a risk, and considering how much they were offering me, I was like, I might have not been worth it, but I actually ended up earning a lot, and the staff was really great. And the point of this is, don't close your mind to only one thing. Be aware that there are many ways that you can get to a goal, if you will. And eventually, if you practice good medicine, you will earn money. Because in this hospital, I was earning them a lot of money because I practiced and offered gold standard medicine, and that's what we should always be offering, even if you think they're financial. Just allow them to decline. And I'm like, okay, that's fine. But gold standard medicine will bring in revenue. That's just how it is. And that's why I said it's not all about the money. So don't just be focused, because I know there's like a lot of loans, people are worried about it. Who here had to pull out loans for obviously med school? Because I've had to pull out a bit. And I at that point wasn't worried about earning, because I was like, you know what, money will come. If I practice good standard medicine, it will always come. All right. Another topic that I feel like isn't really as much talked about is euthanasia and essentially being human. So this one, another story that I've had, I can't remember the exact details, but I remember it's like a 16-year-old male neutered Chihuahua, small animal dog mix. Came to me through ER and essentially was lethargic, not doing well. History of seeing an oncologist, by the way, so it has a history of cancer. Came to me and obviously did my physical exam, did the diagnostic, did my fast scan, and lo and behold had effusion, so in its chest, and I believe its heart too, so fluid where it shouldn't be. And this dog technically now at this point in time would have failed chemotherapy the second time. It has gone through chemotherapy twice. Came to me, family, there's two people, mind you, so now you have to also be aware of the dynamics. There's mom, dad. Dad was clearly just there for mom and doing whatever she wanted. And so mom, however, was like, oh, we're gonna do everything. We're gonna do more chemotherapy. We're gonna like do some more imaging that the oncologist talked about. And I was like, oh, no. In the background, that's not weird. We're not, that's not a realistic view of what's happening. And so, does anybody like have a story, I guess, that really sits with them about like how somebody was able to explain something using a story? Just, you don't have to answer aloud, just like think. Is there anything that you're like really got to you when somebody shared something with you? Would you prefer that over statistics, like the research? Raise your hands over like statistics. Who would prefer statistics? This is fine if you're over statistics. People are more like logical science and things. That's fine. Then raise your hand if you're more like, oh, you'd rather more personal story, right? Okay. So seems like more people will be on my story. So I remember in this specific one, I'm kind of sharing my own personal story here because I got into veterinary medicine because of my own dog. I had a 6-year-old male neutered Malamute mix. A 6-year-old passed away from what I suspect to be oral melanoma. And I think if y'all are at the stages in general at point, we all know how bad oral melanoma can get. And me being, I was young, and he passed away in college. I didn't know and didn't realize how bad it was, and I really, really, really wish my vet told me how much he was suffering, and clearly it sticks to me to this day because he got to the point that he became neurologic and he passed on the way to the vet when he was supposed to be euthanized, the day of. And this is a story that I shared with her that day. I'm like, I understand, trust me, I understand. I had a dog that also had cancer. And like, see that now turning up. I also had a dog that had cancer. And I'm like, if I knew what I knew now, I would not let him suffer. Like, not to say that's what you're doing, but he's going through a lot, and he might not be able to advocate, but I am advocating for him, which is another thing that we don't talk about. We are the advocates for our patients. Okay? And you could see the clock and everything start turning in her head. And I didn't intend to, but I cried. And I think that's really what got to her. And I've talked with a lot of people now, and they're like, yeah, I would rather you like connect to me as a human, be a little bit emotional, shed a little bit of tears if you have to, than be like, oh yeah, statistically, Fluffy's gonna live this long, blah, 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 blah. Because at least I know, like they said, I know that you care. And that you're not just doing this because it's for the money, it's for science, blah, blah, blah. And that's one thing that wasn't taught to me in vet school, it's just something that I learned. And so now I'm sharing this with y'all. So if there's something that can help you connect, whether it's a story, something that you lived through, something that can help them realize and understand as well, just think about it, put it in your pocket. Because I remember coming out of that room and my supervisor was like shocked almost, like, how did you go from one extreme to the other? Because after that, she elected to euthanize. It didn't take obviously one talk, it took multiple. But I was like, hey, I connected her in a way that I feel like more doctors should be doing. All right, so basically that I talked over really briefly. What do you do when basically it's being held together by the owner's denial, which is very much true. Be human, show emotions, hold space for not only theirs, but for yours, because again, this takes a toll on us. So please make sure to take care of you too. Do whatever you need to. After that, take a break, cry if you need to, play some games, hug it out, whatever. And I added this last one because sometimes I'm really awkward and I don't know what to say in these very, 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 very charged situations. And I know sometimes we kind of fall out of things, don't think of things to say. Maybe have a list of things that you can refer back to. This is another example, but I'm gonna kind of skip over it. But it's more about convenience, euthanasia. Know that it's gonna happen, and know what you are willing to do and how to communicate it. Because I unfortunately had to do that literally in the last month or so with someone, and they were very upset with me, but I'm like, I will not be able to sleep at night if I do this. And she's like, okay. So just be aware. We listen and we don't judge. All right. One thing I wish I knew a little bit more is what actually it looked like every day. This is me, I think on a Friday. If you can clearly tell how much paperwork I had to do. Y'all think paperwork you're doing now, know that it's gonna carry on once you graduate. So please figure out a system. I wish, yes, they tell us oh yeah, this is how you approach it, blah, blah. No, okay. Do what you're doing now, but be aware what you're doing and have literally a system, whether it is your physical exam, whether it is your paperwork in terms of your SOAP, know what you like to write your history as, fluffily presented as a blah, 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 blah for blah, 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 science started, blah, 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 blah. Just have it so systematic that you don't really, it's automatic, you don't have to think, and it takes you not a lot of effort, because the faster you, the more you do this, the more automatic it gets, the less time you waste, the more, less toll it gets on you. Because you don't want to be me on a Friday night like that. Okay? So I put this in because I don't remember anal sac abscesses to be such a big thing of what we learned. And I go into specialty, and I kid you not, I had all of them. I had like 2 or 3 every shift would come through. So much so, my supervisor made me this. The Lord goes to the intern that's single-handedly tackled nearly every anal gland ER patient that walked into the clinic. Her case numbers were so high, you may need to consider a new specialty. But there's like a lot of stuff like this that, like, you know, things, diseases that we aren't really focused on, but we definitely see more. Just so you know, academics is not the same as, I would say, real world clinics. So I just put generally what typically the things that I've seen. It will differ from region to region. So GP, gotta put anal sex on there. Allergies, mass removals, cytology, know your cytology. Because when I was here, cytology was optional. Is it still? Or like pathology, clinical pathology. I guess 4th years won't be here. 3rd years, do you know? Yeah. Well, just know that you'll be doing a lot of it, especially if you're in GP. And yes, ER too, but then you're spoiled with their pathologists that you send off to usually. So these are some of the things that I found that repeatedly come up. And so if you see these things and you're like, oh, I'm not very good at this, you might want to brush up on that. Maybe. Just FYI. No. Yeah, vet school will teach you everything, but know that it probably won't be the same as what you see in practice. And again, basics are important. Create a system. Create your system now before you get into practice. Yeah, and the acronyms are very real. We still use them. I still use them. Peace pay, still use them. So they're there for a reason. And I say fake it till you become it. I don't say fake it till you make it. Fake it till you become it. Imposter syndrome, very, very real. Still a thing. Okay? And sometimes, you know, in the heat of the moment, we doubt ourselves. It's a human thing. Even if it happens, be like, okay, well, what would superstar Dr. Nadine do? I'm going to give you a minute. This is a review that was left for me about a 2-year-old male neutered cat that presented for having trouble eating. He was previously seen by the other vet. Thought it was stomatitis. Came back to me. He was recommended dental at that time. And we're gonna hate when this comes, but it's going to come. No matter what you do, no matter how many clients are happy with you, because I've had so many happy clients with me up until this, because this cat ended up passing away after I gave it pred. Does someone have a question? Pred. So I did this exam, very almost normal exam, mild gingivitis and anything, no oral ulcers, open the mouth fine, no heart murmur, lungs sound fine, just a little bit overweight, like probably 8 out of 9, BCS. I was like, your teeth are fine. I'm not gonna pull your teeth because of how this looks right now. And then there's something underlying that must have happened, because the cat should not have just died from pred at an anti-inflammatory dose. But because, you know, the clients don't know any better, this is what they're gonna leave you. They're gonna blame you. He threatened to sue. And you just do the best that you can, and know that I know, and I even asked my group. So the group of students that you're with, your friends, they're gonna be a support team you still rely on, because I still talk to them. I'd be like, hey, this is what happened. What do you guys think? Like, yeah, it's a young cat. Like, what else could you have done? Know that it's gonna happen. And essentially, again, having a systems in check would be really helpful. Like anything that you do for treatment, like if you, let's say for example, a cat with stomatitis, what would you do? But also, the other thing I forgot to mention previously, I know we always have the gold standard A like first plans that we have, but also have your A, B, C, D. If your client doesn't have the money or has more money but not enough, what's the B? If you're like, just half of what you can afford, what's the C? And then D, if they basically don't have any money. And so what I say, the people that you surround yourself is going to be very, very important, whether it's your friends or the people that you work with. Okay? And ultimately, everybody's going through it, so just be kind to one another. I'm sure I wasn't great to work with at one point. I wasn't maybe the best student at one point. Everybody's going through something. And then you have much more influence as doctors than you think. And no matter how hard you work or try, you can't please everyone. And I think the next slide, I'm going to show the influence. So as doctors, we don't talk about this much, but we are leaders. I know you don't maybe want to be a leader, but you unfortunately chose the job that requires you to be a leader. Yes, you're a doctor. Yes, it's important to do those things too, but also, yes, also please take care of you. That is also very important too, because if you're running on fumes and can't listen, can't do anything, well then you can't help anybody. And the next slide is essentially, that was supposed to come in one in one. I asked people, because when I went to a clinic, general practice again, I was personally thanked for not yelling, for not throwing things at my staff, for putting away my sharps, and keeping the bathroom clean. I'm like, and I posted on Threads because I like to be on Threads. I'm like, is the bar really that low? And I listed all those things, and this is what they told me. The other one, it says like, if I had a gun, I'd shoot you all of you, and then obviously that's a thing that was told to them, and I was like, wow. Like, just know that we have a big influence in the environment and the staff that we are in. And I think that's very much understated in veterinary medicine. Okay, so this is a picture before I literally was in my internship, and this is what I say, like, take care of you. What really matters ultimately is you. The one on the left is me. You can tell how tired I am. You can tell how exhausted I am. And this is me on the right, a week after. Like literally the week after I was done with my internship. I like did all the things that made me happy. I did all the things that I felt like was good for me. And like you could really, really tell the difference. And like I'm showing this to be vulnerable because like it really, like your environment and how you treat yourself matters. And people will see it, and your client will also see it. It's kind of like a domino effect, if you will. There are other topics I didn't cover, a lot more, so you can ask me questions. I just tried to hit the most important ones that I felt like I experienced. This is my own personal experience, so I hope you all can learn something from it. But these are just a few of the things that also are very important topics to touch on. And no matter what, you guys, even if you don't feel like it, you're a vet. You went through this school, you're going through this school. It's messy, it's It's human, but also beautiful if you allow it. Cry, you'll laugh, and you'll swear a lot. A lot. I'm trying not to swear here, I'm trying to be professional, but you swear a lot. Like, who the Anyway, we listen and we don't judge, right? Right. Yes. And then more often than times, you're more ready than you feel. You know more than you think. One last story that I'll share with you, very, very recent, literally just like days ago. Someone called me for a bird. I was like, it's my friend, it's a really good friend of mine. It's like, my friend's bird is acting sick. And like, I don't know who else to call. And I was like, okay. Tell me all the things. So you ask all the questions. What's the nutrition? How are we doing? What's happening? What's around? So you kind of go back to the things that you've learned. And trust me, I'm going back into like my exotics rotation when I was here, /NAVLE. Oh my gosh. Going into that knowledge. And I was trying to like bring it up to the front of my brain while I was driving because she was calling me. I was like, what are the most common things? Do you guys remember? Do you guys know? If anyone knows? No? Okay. The most common things usually with like exotics tend to be nutrition, toxin, other things. But one of the higher ones is nutrition. It's the one thing I remembered from studying NAVLE and exotics. And so I was like, well, it's probably this, nutritional, more than likely it could be this, but you have to do diagnostics, blah, 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 take it to the vet. They did, ended up being nutrition. And this is me not practicing exotics at all, okay? So I'm just saying that you all have the knowledge, you just gotta bring it up to the surface. And don't doubt yourself. Because I was just like, someone who was just being small animal, I would have been like, is that really true? Did I remember correctly? Like, I don't know. But then I was like, I feel like this is right. And it was right. Yeah. So that's me on a Friday night, being like, why did I do this to myself? Wish I had better systems in place. Don't be like me on a Friday night. I'm much better now. But, hopefully y'all learned something, and I tried to leave room for questions, just in case y'all had some. And then that is all the topics that I had for today.
So why did you decide to go into relief work, and how is that working? Like, what is your general schedule like?
Why? Okay, so question is, why did I go into relief work, and how does my schedule and how is that working out for me? So I will be 100% honest in that it was very scary at first because I was like, one, you'd have to pay your own health insurance, one, it's not like stable. So for those that don't like to go with the flow and unknowns, it can be really, scary at times because like for example, right now my shifts in October that I signed up for basically didn't get accepted, and so I have a huge gap where I'm not being paid, and so now I have to find shifts. But for me personally, I chose the relief because I just got from an internship, and if y'all don't know yet, internships are rough. You learn a lot, but they are very, very rough. You're there like 12 plus hours every day for 5 days, sometimes 16, 17 hours. Then under the critical eyes of your supervisors, expected to know basically all the things that you may or may not know. And so I went to relief work. For me personally, I'm having a great time. Even though, yes, there are some things that I don't know, like I don't know when my next shifts will be, I don't know like how much I'll earn. But again, for me personally, I'm like, well, one, doctors are always needed. So there will always be doctors that are needed because everywhere needs relief vets. Then two, as long as I, again, practice good medicine, I will earn money. And then three, the other thing is I also am choosing not to work as much. So I'm like, well, I did kind of put this on myself at this point. But it's working really well for me because literally, like, before this, I worked 4 overnights. And then before that, I was in San Diego for 2 weeks because I went to IVEX, the Veterinary Emergency Conference, and I went to a mental health conference. So for me, I really like it, but it's not for people that, you know, don't like not having a sure thing. But eventually you get kind of in the groove. You just have to put yourself out there, connect with people, talking, all of that.
So when you have the conversation about euthanasia to the owners, did you usually push the euthanasia through the owners? Like, because say animal is already like really sick and we are concerned about the quality of life, did you kind of like push through this direction to the owners, or it just depends?
For me, I guess it depends on the animal. So let's say, for example, that Chihuahua, I was like unintentionally pushing for it because I was just like, this doesn't make sense. Also, like, and reason why, you're just gonna put more money, you're gonna prolong the suffering, you're gonna like prolong not only the animals but your suffering. And so I'm like, this doesn't make sense to me if in the end it's gonna be the same result. The same result is the animal's gonna get very sick and going to die. As much as they can't accept it, that's what's gonna happen.
I asked this question is because I had a case this summer that the dog came in with a really bad metastatic mast cell tumor, and the owner insists not to euthanize it because she had a family member recently get diagnosed with cancer as well. So I don't think that is like, as a doctor standpoint, yes, we concern about the animal, but I think sometimes you need to consider the owner's background as well. And so we end up not euthanizing the dog, but I don't know if this dog is dead already. At the time, I think the mast cell tumor is already like spread to the thorax and stuff, but the owner just say, I don't want to euthanize it because I want the dog with me. So I think that's a really hard conversation. So I was a little bit like disagree. I think that we need to think about more owner's background in your situation instead of just pushing through the animals to the euthanasia.
Yeah, no, I definitely consider, I can agree with that. I consider owners and animals. That's why I was saying finances, like financially this doesn't make sense to me. Like emotional toll wise it didn't make sense to me. Animal wise it didn't make sense to me. And that's why I was like, hey, like, that's why I was explaining the things that I did, and obviously it clicked in her brain somehow, and she was like, oh, that also doesn't quite make sense in the long run because it was also metastatic. They had a fusion, failed chemotherapy twice. I'm like, now your prognosis is getting shorter and shorter. And to me, that didn't make sense. Like, as much as, yes, I did offer like, hey, we can try, but I don't know what would change if you just, like, the imaging that you want shows you what you already know. And then now you're in the whole $5,000 when you already know it basically just confirms what you already know. Like, it didn't make sense to me. That's how I approached it, at least. And that's why she's like, oh, okay. And then she thought about it. I didn't intentionally, maybe I did subconsciously, but I wasn't trying that hard to push for it.
Were you glad that you did the internship after graduation, or did you ever wish that you went institute after?
So question is, am I glad that I ended up doing the rotating internship or wish that I did something else? Correct? Okay. I'm going to be 100% honest in that I was really wanting to quit up to 1 month up before the internship because it is that rough. You have to be mentally prepared. Like I called it my mental and emotional Olympics because I didn't say it, but I was on the judo team and I was going for the Olympics. That was my physical Olympics. Rotating internship is like your mental, emotional kind of Olympics. And yes, it's really rough, but at the same time, once I got out, I learned so much. Like my standard of medicine is much higher than what I find other doctors, even with me just coming out as a new intern. So yes, it's rough, but I do believe it is, you get a lot of it. If I could, I would repeat it again, if I could, because it was really rough, if I'm being completely honest. But I learned a lot. And I would recommend if you could go through all of that without and find clinics, because there are, because I met someone that, was talking about or my internship was not like that. I was like, that must be nice. So there are out there. You just have to find them. I think someone had in the back.
I was going to see if I could share a perspective. I'm not in vet medicine, that's not my background, but I do have a background as being a patient in vet medicine and having two animals with similar situations and having to choose euthanasia on the second go around and then taking my home. And the difference of that and having a doctor that I felt advocated for my animal and me made a huge difference. And also just having a conversation of showing the steps and walking your patient through, I feel like made a huge impact on me. Because it was difficult bringing my animal home and having that sort of end of life for them. And it was also difficult having my animal go through euthanasia in a different situation. So I just wanted to give that perspective. And we do look to you guys as vets to show us what we don't know. Because I have never experienced that before. I don't know what to expect.
Yeah, no, that's a great input. Thank you. So basically, she was sharing that the two different ways, home euthanasia versus euthanasia, and talking to you and the steps and everything, because I think a lot of us forget that our clients actually don't know a lot. This not to be mean, but it's some of the basic stuff we know they don't know, and you don't know where they are in their journey. Whether it's their first pet, second pet, third pet, fourth pet. Even if they're being a breeder, for example, there's still some things they don't know and they think they know. So I think, again, the whole we listen and we don't judge, and we talk to them, ask questions, try not to make assumptions before you go in, because a lot of times people assume that, the staff I worked with are oh, they're financial, we're not going to do anything. And I was like, oh, well, we haven't talked to them yet. And then usually people are hesitant because you don't explain the value of what you're giving them. And a lot of times, I think that's what people find here in WSU. They come and oh, but they didn't explain it to us like this before. Oh, now we could do it. I was like, so you just really need to talk to your clients.
Okay, that's time. Thank you all. And grab some food on your way out. The more you take, the less we have to move. So thank you. I need that picture for the contact, by the way.
Is that
Oh, I need that for sure. 1,000%. That is going to happen.
Wait, I need to grab food before.
Yes, please do. So there is. Saeed, done.
So when it came to
Great job.
Thank you. What's that? How was it? Did it pass your expectations?